devolution era has yielded significant results in this regard, increasing access for mothers and reducing morbidity and mobility for both the mother and the baby. With 89% of mothers currently delivering under skilled care in Kenya, as compared to 66% before devolution, that is before 2010. There has been a rapid decline in maternal and child mortality rates, and I would say that between 2014 and 2022, Kenya's under 5 mortality rate reduced from 52 deaths per 1,000 births to 41 deaths per 1,000 births, and the infant mortality rate from 39 to 32 during the same period per 1,000.
We are saying we must produce fit for purpose. Don't just produce. Sometimes in our space of regulation, we find that, like I'll give an example just from medical school, CF is here. They are producing 1,000 doctors now. 5 years ago, they were producing 300. So we wonder if those 1,000 are able to fit in those internship centers, the training centers, and getting exactly what they require to come out. So those are the things we want to look around and see what they are doing. So production, we want to see fit for purpose production. Between the institution of training, we are training for 2 markets. We are training for our Kenyan market, we are training for the outside market. But we don't want to overtrain what cannot be absorbed. So let's train what we really do need.
For a doctor to stay in Wajir, they need to be remunerated in a way that it gives them motivation to stay there. While a doctor may not need any motivation to work in Ruto'S and Thika and on Ngong Road in Nairobi. The difficulty with recruitment and retention is a big problem because internal and external migration of health workers is at all-time high. The development of training programs for community health care workers could not have come at a better time in Kenya than now, when the country has just enacted 4 acts of parliament to achieve universal health coverage. These acts have introduced fundamental changes in the delivery of health services in Kenya, placing primary health care and community health promoters at the center of health delivery services. We spend as African countries a lot of money in training our health workers, and we are giving them out for free to Western world. At the ignorance of assuming that they need jobs because they're jobless, yet our health facilities have a shortage. The reason I'm saying this is because you know very well that we do not have, especially in Kenya, and you've put it so well that this is handled by labor. The training is by Ministry of Health. But when you come to giving away the workers, they're given away by labor. We do not even bother to know how much it costed to train them in terms of government resources, which is taxpayers' money. You know how much it costs to train one nurse, how much it costs to train one clinical officer, using taxpayers' money because they don't study at home. But when you give them out to the Western world, you give them out for free, nothing comes back from those countries to support the training in these institutions so that we can keep on churning more of those health workers to be able to have no break or no gap in delivering both for us and even out there. The doctors have preference to work in the cities and urban areas vis-a-vis going to the villages where we have less opportunity to have private practice and also have less workforce, and therefore may not be having very big opportunities to be able to venture into private sector. But the disease burden is usually highest in those rural areas. So there's a paradox. We complain that we do not have enough health workers in our facilities. It is true, I gave you a ratio of 14 to 10,000. Why is it that we have very many nurses who have been trained coming out of the nursing and medical colleges, yet we have shortages in our facilities? It is a question of affordability, it is a question of funding to health. While we are complaining we are having a brain drain of doctors and nurses who are going to Western world, we as a government are not able to afford to employ them because we do not have the resources. Recently, I advertised for a position of 30 nurses in my county. I got application of 667. And those are not working in any other facility. Those, because we say in the application, ensure that you're jobless. Those are the ones you give. So you have very many nurses at home. Some of them have been there for 2 years, 3 years, and therefore, by the time we hire them, they also need refresher courses, Professor Kanyinga. So when you are tailoring this program, you should have a refresher course for those who stay at home for a longer time before they are taken for employment. Because it's there in Kenya. Whether they're going out of this country, whether they're coming to our facilities, they need refresher training.